Let's bring him in, Dr. Joe. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, on board with us this morning. Joe, good morning, my friend. What do you have for us this morning?
Hey, Ray, I wanted to talk about a injury that's been around a long time, but sometimes we get away from talking about it. And I've seen a few this winter that have been kind of people aren't sure quite what to do with this common injury, and I want to review it again. We have a whole new generation. I keep forgetting about that new generation of parents and trainers and coaches, and so the injury that's real common, and it's coming off the season that we just come off winter season. There's an injury, a significant deep thigh bruise, and it is deep thigh contusion. You talk about, and so indoor soccer, people get kneed above the knee into the thigh, or in basketball, this happens quite frequently. I've seen this winter a couple times, really unusual, where people have dropped weights in the weight room, free weights or weight bench on the thigh muscle. And what happens is when this kind of a injury happens, it breaks a lot of the small blood vessels underneath the skin, and it will bleed underneath the skin, and a pocket of bleeding will form depending on how bad that original injury is. And that pocket of bleeding is known as, our fancy medical word for it is a hematoma. And I've seen a couple of really nasty hematomas this winter. So this hematoma is a collection of, like, a pocket of blood that forms, and it can be, we talk about, oh my gosh, it's the size of a fist, the size of a deck of cards. I have had one this week that was the size of two fists, really a lot of bleeding in that area. And so it's painful. And so what a lot of people want to do is they put an ACE wrap on it, or they put them in an immobilizer or crutches, and that's exactly the wrong thing to do. So I want to review that with people. Is the first week, 10 days, 2 weeks is really critical. And if people are not doing anything to mobilize that blood pocket, that hematoma, it can harden and form a thing called myositis ossificans, which is kind of bone that forms in the muscle. And people lose a significant amount of range of motion, which, as you would imagine, if you can't bend and straighten the knee, you're going to be hard-pressed to play. And when these go on for a while, I've had athletes that are out for 3 months, 6 months, 9 months with this myositis. And so it's exactly the opposite. And I know it's a little bit painful early on, but for one thing, with this, a lot of times people will have a lot of pain. Probably with a bad hematoma or deep thigh bruise, you need an X-ray to make sure that there's not a fracture to start with. But then you a lot of times can really use help from your athletic trainer in your high school or your sports physical therapist to mobilize or get rid of or move that fluid as quickly as possible in the first week so that that range of motion comes back. And then within 2 weeks, it's a relatively no big deal, lots of bruising. It'll really look ugly with a lot of bruising, but the movement comes back. People are back playing sports in 3 weeks, 4 weeks, 5 weeks, and they get their strength back. Versus the people that just, oh my gosh, it's so painful, I'm not going to do anything with it. So the real key is making sure that people realize, again, mobilize, 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 we call it. You want to get that blood moving, get it out of there, and get the knee moving. It does happen occasionally. I think we've mentioned it before in the upper arm, too. If people get a blow up on the outside part of the deltoid, they can get bleeding in that area, too, and it will harden. But far and away, the most common thing in the season we came out of with just the indoor basketball and indoor soccer, a lot of kids are really dealing with this in the thigh muscle with a deep thigh bruise. And I just wanted to remind everybody, get on it, get moving, talk to your health professionals, and they'll know what to do. And a deep thigh bruise can be something that, oh, my gosh, no big deal. Oh, yeah, if it hardens, it's a really big deal. And I just wanted a reminder for our athletes out there again, a whole new generation of athletes and coaches.
Joe, is this where, and you mentioned moving that blood around and, getting the liquid around in that bruise, is this where that cupping can come in and help that we've seen really come to the forefront as far as helping with bruises and soreness? Can that help in this area, or is that not a factor?
Yeah, anything that gets that blood moving and breaks up. So it's like in a pocket of this fluid, this hematoma. Early on, a lot of it is just even using the muscle. There was a great naval study that showed if people are doing a lot of flexing, extending, they have to do their exercises 3 or 4 times a day. Your muscles push a lot of that fluid out of there. Then the therapist will go to a lot of deep tissue treatment. Sometimes they'll even use a device to really deep massage to push some of that fluid out of there. And then in the later stages, at the end of a week or two, you're absolutely right. People may be using things like cupping and even dry needling in the later stages. But the point of the matter is, it's not one to just sit on for a period of time. It's an injury to really be active with and get it moving.
All right, Joe. Good information in the world of sports medicine again. Good talking with you, my friend. We'll do it again next week.